and welcome back. My name is Sheldon McLeod. This is Thinking Out Loud. It's my spot here at SaltWire.com. Again, remind you about our new YouTube channel. Look for SaltWire on YouTube. Subscribe, like, and all the stuff that goes along with that. I thought it was really interesting. Ready, responsive, and reliable. That's what Health Minister Thompson says we need from our healthcare system right now. And there was a summit that had been planned, and I assume well in advance the news that we saw these two women die after trying to access emergency medical care over the holidays. And then the big news from just moments ago, Minister Thompson and the CEO were there to talk about some of these improvements to help get emergency care quicker for Nova Scotians. And a lot of that had to do with the personnel, the people who work in the system. And Janet Hazelton has given of her time today to me. I thank you very much as president of the Nova Scotia Nurses Union. Thank you so much for speaking with me. I appreciate it.
Not a problem. Not a problem.
And I thought this was interesting that Michelle Thompson shared a bit of a story of her own practice, saying, when she started in nursing, a lot of the time was spent trying to justify patient care and the resources that they had. And in some ways, the big warning signs were ignored. I know you've been talking about staffing and retirements for quite some time. Are you in any way surprised with the response in the government plan rolling forward on getting access to emergency care to Nova Scotians?
No, because, we've been saying for a very long time that we need nurse practitioners. I know we published something about 6 or 7 years ago saying a really nice role for nurse practitioners would be in our emergency departments so that they can see patients that may not require care within the next hour or two, so are non-urgent, but they still require care. Then people need to remember that they still require care. It may not be emergency room care, but it's not care that they can necessarily wait for 7 or 8 days till they get in to see their family doctor or nurse practitioner. So they have strep throat. They can't wait 2 weeks. They need to be seen. They need an antibiotic. So nurse practitioners are ideal for that. And most recently, they've been introduced, and we've got 2 or 3 and about to have a lot more, is RN prescribing, which is going to be phenomenal. So, RNs being educated to know that they'll be able to provide prescriptions for a lot of our antibiotics and be able to discharge patients so that they don't have to wait 6, 7, 8, 9 hours, because that's a long time to wait. They're not feeling well. They don't need urgent care, but they're still not feeling well. And 9 hours or 10 or longer is a long time to be sitting in an emergency room waiting with a sore throat. And what happens is, 40 to 50 to 60% of the patients in our emerges are just that. They're waiting for non-urgent care, but that, instead of having 40 in a waiting room, now we have 80. Or 90. And that just brings the temperature of the room, the room up, and that people are anxious. It's overcrowded. People are sick. And so it just increases the temperature. People get frustrated. They get angry. So I think backing them out of our wait rooms is really going to help. And then we're only watching or seeing 40 people instead of trying to keep an eye on 80. That's a lot of people to make sure that their health status has not changed.
There was a comment that some of these actions were not in direct response to what had happened with the deaths of these 2 patients over the holidays, but that having a doctor with responsible for triage and available to reassess, re-triage, and to have a patient navigator of sorts, someone in the ER, sort of a bridge between the waiting room and the emergency room, offering comfort and support and information, because I think that's where a lot of this frustration that ends up presenting as aggressive behavior towards nurses and nursing staff and hospital staff. I'm curious if how quickly that kind of situation can be put in place, knowing we already have some significant staffing issues.
And we already have it, like the Directorate General, we do have a nurse that's assigned to the wait room, and we have a nurse that's assigned to assess patients as they come in by ambulance. So it is, but it's patchwork. So it's in some places and not others. So seeing this applied uniformly across the province is going to be really good. It will depend on on what the skill set of the person is that's chosen or that is hired to do that work, because we need someone that has, they may not necessarily have to be a nurse, but they need to be able to do somewhat of an assessment of the patients to be able to be of help, to us. And again, any help is better than none, but we need to be very careful about who gets those jobs and what their expectations are. So if someone says my throat is sore, or, I don't know necessarily, we don't need them to be going to the triage nurse to say, Janet Hazelton's throat sore. So, because that's not going to ease that workload. So we have to really look at what those roles are responsible for and what the expectations of those roles are if they're not nursing.
The minister said, and the CEO said, a lot of this information is coming from, these ideas are from people who are in the trenches, if you want to use that terminology. Do you feel that your members are being heard, that they're being listened to, that their concerns are being addressed?
Yeah, I think so. I think I would have liked to have seen, some tuition relief for nurses that was there for paramedics. I would have liked seeing that a little more universal. I would have liked to have seen, if a nurse there are courses if you want to become an emerge or an ICU nurse. I would have liked to have seen that any nurse that would like to do that are currently working, that they'd be able to do that and it would be funded. Every announcement that's made, I look to say, because I represent nurses, obviously, what in this announcement is going to make the day-to-day life of a nurse better. And so I think if although good, I think it could have been better and more, and hopefully it will be.
When it comes to addressing some of the staffing shortages, specifically to nurses, there was a time where we had multiple areas of the province, many places you could go to become trained to become a nurse. That's changed over time. Some would say it's evolved to be more responsible to the higher needs of patients. I'm curious, do you feel we're doing what is needed to recruit, to get more young people or other people into the profession?
I think we're doing a really good job of recruiting. There is wait lists for most of our nursing programs. I think where we're falling down is retention. It's one thing to get them in the door, and I spoke to nurses that are about to graduate in April this morning and last week, DAL nurses that are about to graduate. And the important thing is we've got them. It's once we get them, how are we going to keep them? And those that are in the system that are 15 years or 10 years or 12 years, what are we going to do to keep them? So what do they need to stay and work, rather than saying, you know what, I'm going part-time, I'm going casual, or I'm quitting altogether? Because there's only so much that a person will take before they say, I'm tapped out, I'm out of here. And we're seeing that with our senior nurses. And we're seeing that with our mid-career nurses, that although they may not be leaving the system, they are reducing their full-time status from full-time to part-time, which is not helping the system. So we need to pay attention and talk to nurses about what it is. And I can tell you the number one thing they're saying is not money. It's work-life balance. I need work-life balance. I need time off. I need my vacation. I need not to be working 16, 18, 20 hours when I went in for a 12. So saying, oh, well, is not good enough anymore. We have to fix it. We have to figure out a way to make that go away.
I know it's anecdotal, but I've heard from nurses who are at the end of their 12-hour shift calling in sick so that they're not forced to work overtime. That seems like it's not necessarily addressing what you're just describing, which is that work-life balance.
Right. I mean, and they are sick. Like they are. They're tired. They're not at the top of their game, and we need our nurses at the top of their game when they're going in to look after patients every single day. They need to be alert. They need to be not tired. They need to be able to think. And so you can't expect anybody to work 24 hours and be at the top of their game. Or even 18, especially with the type of work nurses do. It's physical. it's mental, it's very, very difficult. There has to be a solution. When the health authority employs thousands and thousands and thousands of nurses, there has to be a way that we can address this problem. There just has to be. And so we can look at potentially having travel nurses for the province. Instead of bringing them in from other provinces, let's have like our own travel nurses that are willing to go work in Shetty or New Waterford or wherever. And that's part of their job. Let's talk about, and it's time that we think outside the box, that we say, if a nurse practitioner wants to work in Spring Hill, how do we make that happen? And what does that nurse need to go and do that and be successful?
When we talk about travel nurses and the morality, the moral perhaps question, or maybe even the self-evaluation where you say someone standing next to me has the same training and experience, but yet they're making a wage that's considerably different, and they're getting their vacation and they're getting their time off. I'm wondering how it has government in any way said to you that they recognize that that's causing some real issues within the morale level within staff?
Oh, yes, they understand it, but their point is, like, when I have all these holes, how am I going to fix it? And so, and so it's sort of like it just keeps on and on and on. Like, we're not fixing the situation, so our nurses are quitting or reducing to part-time. We're still not fixing the situation. So eventually we got to go to travel nurses, or there'll be no nurses at all. We need to slow down, stop, and just start from scratch. Like, we just need to stop and say, okay, like, let's build a system within Nova Scotia that'll be able to look after Nova Scotians, and we'll have everybody working to their full scope. We'll have everybody doing there's enough work for everybody. There just is. And so we need to sit down and say, is there things that physio could be doing that we could use? Is there people that could come in and walk our patients, someone that comes and with minimal training could, go down and take Janet Hazelton for a walk up and down the hall. Because now a lot of those things now nurses are doing. And that's, we're at a point, and nurses like doing it. So don't get me wrong. They like to see it, and it's a good assessment of their patients. But we're at a point now where we're going to have to start prioritizing to say, okay, what can someone do to help the nurse do their job? And after 3:00, 4:00 in lots of places, everybody disappears. Like, they're all there in the day, but they're never there on the weekends or after 4:00. Well, it's a 24-hour, 7-day-a-week system. And maybe more than just nurses and a few others have to work more than 24/7.
And maybe alongside of that should come a compensation for it, that there may be a premium. I know you and I have spoken about this in the past, a premium for shifts that are overnights or on weekends or.
And we had it, but it's like minimal. It's you can't pay a daycare. You can't pay your daycare for what extra the nurse gets. So I agree. If you want people to work those off hours, then $1.50 or $2.50 or whatever it is an hour is not enough. It's not enticing enough. And so I can go work days, but so what's enticing me to work these off shifts? And those are the things that, the unions, the nurses, the unions that represent nurses in this province are wanting to have conversations about.
Premier says he doesn't want a turf war. And as you say, this isn't an us against them. This is it's all of us. It's the province and the patient. So how do we see our way through this? How do we put those other things aside? Well,
I don't think at this point we have the luxury of not. I am not just the president of the Nurses Union. I'm a Nova Scotia citizen with a family. And I want to know that if my family gets sick, that they're going to get care that they need, deserve, it's timely and it's appropriate. And so, and every Nova Scotian deserves that. And I believe every Nova Scotian can have that as long as we sit down and like the Premier said, not a turf war. It's okay, this is the work, how do we divide it up? How do we make sure, and really in hospital, you're there for nursing care. That's what you're there for. Like when you have surgery, you're staying a lot afterwards for nursing care so that nurses can look after you. So what do we need to support that very important care that has to happen?
You've been president of the Nurses Union for quite some time. You've been in charge when there has been numerous governments, numerous ministers, numerous premiers. The situation seems to be at a crisis point. Everyone talks about that. Is it as bad as it appears to be? And are you hopeful that it can be resolved?
It is as bad as it appears to be in some ways. But I want to assure people that most, like our CCUs are full of patients that have had cardiac events and they're getting phenomenal care. Our ICUs, phenomenal care. And all our units are working to the best of their ability to give the very best care they can. Can they be given better care? For sure, because we don't have enough staff. So if I'm supposed to have 6 patients and I have 12, obviously I'm not going to be given the care that they deserve. But nurses and others are trying, and they're working hard, and they're prioritizing. So, they're looking to say, it'd be great if I could give Janet Hazelton this, but I can't. I can't today. I don't have time. I have to do other things. So we need to but it's not, like, I don't want to say that the system is no good and we got to throw it out. It is good. We just have to fix it. So it's in ICU. Our healthcare system is in ICU. But I think we can help cure our system. I think if everyone pulls together, like the Premier was saying, I do believe there's intent. I saw it yesterday in the summit. Everyone around that table wants to help. They want to do whatever they need to do to make this be a better Nova Scotia. So that gives me optimism, to your point. I was optimistic leaving because Doctors Nova Scotia was there, physiotherapists were there, pharmacists were there. Those individuals, all there saying, put their hands up to say, what can I do to help? And that's reassuring to me.
Janet Hazelton, is there anything else that I didn't ask you that you think is important to add to this conversation?
No, other than the fact that we really have to be mindful as a patient and as a citizen about how we talk about and treat our healthcare workers. It was very disturbing that, I've heard from nurses that happen to work in emerge departments that, that are very unkind things are being said about them. And, they're doing their job. They're doing their job as best they can. And they don't want people to be waiting 8, 12 hours. They don't want any of this. So just remember that as a patient or a Nova Scotian, healthcare workers are working very, very hard, and they deserve respect, and they deserve you people to understand that, being inappropriate, rude, physically intimidating, it's not helping the situation. In fact, it's making it worse. And so it's making nurses and others say, like, why am I getting up and going back in there today so someone can yell at me 4 or 5 or 10 times? So I think the last is, I know it's cliche, but take a moment and think what those individuals are doing for you every single day.
President of the Nova Scotia Nurses Union, Janet Hazelton. Thank you.
Thanks.